Welcome to this episode of Let's Talk, where we zoom in on the practical applications of some of the most talked about sessions here in the Monaco Congress. In this case, we specifically zoom in on the timing of complication management and more specifically on bone grafting procedures. My name is Gerrit Heijkoop and I'm very proud and honored to be joined by the chairs of this session earlier today, Hadi Antoun and Luca de Stavola. Welcome.
Thank you very much.
Thank you.
It's a pleasure to have you both here. You just walked out of the room from the stage into the studio. Let's start with the very basics. We are in a congress talking about the impact of timing in implant dentistry. You specifically zoomed in on bone grafting procedures. Why is it important to address this topic here today?
We have complications not only in bone grafting procedure, but it was one of the fields that we have complications. And here we have three main, let's say, fields where that was developed in the session during immediate implantation, after augmentation, bone augmentation before implant placement, so during the healing period mostly. And then the third part was concerned peri-implantitis and grafting, the defects around bone loss after this kind of illness that happens in certain percentages.
Exactly. So different times when complications may occur.
Yeah, right.
Specifically the bone grafting, why is that such an important element?
I mean, bone grafting is involved in majority of the therapy when we're talking about implant. For implant proper placement, for the steady final result, it's not just bone. In many cases, it's a combination of hard tissue and soft tissue. And talking about complication is like to move out and discover what is behind the success that usually is shown. Yeah. And this is something that is extremely important to share with colleagues. Because we feel very nice when we are sharing our success, our long-term results, when the patient is every time happy. But we are absolutely ashamed when we have to talk about things that are not running in the right way. And usually there is a lack of communication from this perspective. I mean, the colleagues today, even at the end of the lecture, we're not moving from the chairs and waiting for the discussion, for the questions, because there is really a lack of research behind the complication that everybody has in this office, because even the best sometimes is not performing as the best.
Exactly.
And we must have answers, opinion, just to share the negative events and find potentially a solution together. And that was, I think, the really core of our session.
So it's very courageous then of your three speakers to go out and share. Often it's as a complaint in these congresses. We only see the macho success. Look at how good I am. In this case, it's a more modest and honest conversation. Let's look at you both and what you took away from those three speakers. Let's start with that immediate scenario, complications in the immediate scenario. What sticks with you, Hadi?
So Purya pointed out, let's say, the most important, the key factors that leads to success and that prevent complications. So, and he insisted a lot on patient selection and the patient criteria, the high smile line, the phenotype, the bone volume available, and so he really insisted on all how to prevent complications. So it was very didactic presentation.
Yeah.
We didn't see a lot of complications, but we can go with the take-home message in order, with many, let's say, lessons to avoid as much as possible.
But to be honest, Hadi, I've been in some of these congresses before. I think we hear that story a lot. So the real underlying question is, why do we still need to repeat that message that it's so important to make sure you apply these procedures, especially immediate, specifically in the aesthetic zone, to patients who are fit for that? Why is that still going wrong in practice?
any surgery has complications.
Yeah.
Today, we cannot pretend to do surgeries in any field, not only in dentistry,
Yeah.
without complications.
No.
So this is, I think, mandatory.
Yeah.
But the point is to reduce as much as possible
The chance. I agree. I agree.
the complications. And this is a way, when you select your patients, you will reduce the complication. But it's not enough. You select the patient, then you have to do a diagnosis, then you have to choose the best option for this case,
Yeah.
and then you have to apply, you have to learn how to do this kind of surgery,
Yeah.
and to do it with the good protocol.
Exactly.
So it's question of
It's an attitude, right? Yeah.
Thinking, and then it's question also of handling and executing the good procedure.
Yeah.
So it's a long way to succeed, and I think sharing experiences and sharing failures, this is really, really important. This is how we will avoid as much as possible complications.
Yeah,
that's
you
why
say, so these criteria, we're still learning on which type of patients we should have not selected.
Yeah, this is important, absolutely.
Yeah.
Luca?
I think that is important to go and insist to the fact that the patient selection is a crucial point. We are mainly focused on technical aspects, usually. How to raise a flap, how to take the connective tissue graft, how to fix it.
Yeah.
And but the strategy is the chance to be successful is because we are selecting the proper patient, or or we selected the technique for a specific patient.
Yeah.
And usually you see a lot of colleagues that are technically extremely good, but they repeat that in any type of scenario. In any case. And then they have the good case and worst case. And sometimes they don't realize why. I was doing exactly as the previous patient, and that was an amazing success. And here I'm not getting the same result.
So here you both feel that the importance of that patient selection is still a bit of a blind spot?
Yeah, because it depends, on the surgeon, on the practitioner. This is really a question of motivation and a question of philosophy. For example, we were talking about smoking before. Do we do any bone augmentation for smokers?
Yeah.
So with Luca, we were in accordance, and we were saying that smokers or very light smokers, we can.
It's a contraindication.
It's a contraindication, but for others, it was not the case. It was more the choice of the patient. But I think with Luca, we really agreed on that it's not only it's not the choice of the patient, it's also the choice of the surgeon, because it's our responsibility.
Because we now know, based on the body of science, the evidence now coming out, that this isn't failure waiting to happen. That is the message. Yeah.
Definitely.
Did you ever have to face such a dilemma yourself? Well, because obviously it's nice to say in this Congress patient selection, but it actually means sending away a patient who is looking at you for help.
It's not necessarily sending away, but find another solution.
Yeah.
And teach him that the other solution is for his specific case better. And better means that he's going to have a good impact on his quality of life with less risk of retreatment.
Yeah.
Because the point is that there's a lot of cases that I saw, because at the end, when you are recognized as an expert on a field, you receive the failures
of course, you get the most complex cases.
And in the majority of the case, that's why I say that patient selection is a key point. You realize that was not the case for that type of surgery.
Yeah.
And you have to change the strategy, and you have also to explain the patient why we have to change the strategy.
Yeah.
And I think that every time, and I say to the patient that every time there is a solution, it means that the problem can be solved.
Yeah.
And it's the point. It's obvious that their patient has an idea in his mind, and he would like to reach that point.
Yeah.
But we have also to face with the reality that sometimes is.
But
not
Luca, how do you
reach some
deal
result.
in this relationship if your patient was with colleague A, obviously not selected for the right treatment, now comes with complications to you or to you, Hadi, and now you propose, well, this was the wrong strategy in the first place, now we go on to plan B. I, as a patient, would get some trust issues in the professionals, right? Because I cannot judge. You are the major expert, and the other one wasn't.
The message is not coming like this,
no,
obviously. But it's for sure that we try to give the message that we have to find another way, because it's risky to try to reapply the same approach.
Yeah, because that's evidently gone wrong.
Yeah, right. And I say is not in many cases a technical problem of how was performed the surgery, but was the concept behind of that treatment that was wrong.
I think also that we really have to think about alternatives before going to the surgery, specifically when we talk about bone grafting procedure, and that was also maybe an answer for your first question, because grafting procedure could be invasive. It depends on which scenario we're talking about, but I think the alternatives has really to be discussed first, even if the patient is a good candidate. For example, replacing a central incisor today with all the bonding evolution we have, it could be a good alternative, and we really don't need sometimes and many times to go through complex surgeries to reconstruct bone and soft tissues. So really we have to think about it, because sometimes also the treatment is concern more the surgeon. He wants to do the best for the patient,
and he or she has a specialism, and this is what I do best, and you end up in my chair, so I do what I do.
In French we say, le mieux est l'ennemi du bien. The best is the enemy of the good.
Yeah, that makes sense.
So sometimes we have really to know where to stop and to choose maybe the better option the better option for the patient.
And we can all feel that's difficult, right? Especially if you're, as a professional, you've been developing, you're on a learning curve, you've been investing in your education, for example, watching all these videos on platforms like this. What have you done to be able to get a little bit more distance and be able to actually do that proper selection, and perhaps sometimes say, well, I go for an alternative plan?
Well, we do mistakes also. Sometimes I did bad choices. I think the fact that we teach, that we share our cases, it's a very good point to take this distance. I think we learn a lot when we prepare our presentation, when we prepare our conferences, because we go deeply, and we have to really to learn from our cases, and we look at our photos, we look at our x-rays. I don't think that when you don't do this kind of exercise, it's not always easy to go back to your cases and to watch what's happening. Yeah. So I think it's really a good opportunity for us. It's a chance to have this kind of exercise and to prepare our presentations, because it's really a good way to have this distance.
This learning and this distance. So the interesting perspective, if you're watching this now and you're just working hard in your clinic, you actually say, see if you can either go teach locally or go get involved in science, because it forces you to take a step back and overlook your cases and see if you see any patterns.
Sharing.
Makes you a better dentist.
Sure. And then if I add something, is also a cultural problem, meaning that we should think to try to expand our ability with different techniques. Because one of the limitation on selecting alternatives is because I learned this
and I don't know the others.
And so the way to solve the problem is just one single way. There is one single shot. So force ourselves to learn different things, different approaches and different techniques allowed us to have the freedom to select for that could be scientific reason, or also personal reason or technical reason by doing the surgery, but have the freedom to say, okay, in this case I will do this because I think that this is the best option instead of what I'm usually doing.
This is what I know and this is what I do. May I ask a personal question? How do you organize that? Because we all hear and feel it's busy. There's a lot of waiting list in dentistry. There's a lot of pressure on the profession. And now we say, well, the most important thing is also get involved in teaching and learning different skills. How have you personally organized that?
Well, I think that the experience, as Heidi was saying, allowed us in the years to build up our decision tree.
Yeah.
And so that when you analyze the defect itself or analyze the problem, you try to go to specific parameters.
Yeah.
And at the end, I like every time to say that is the problem bringing you to the solution. More than we are approaching the case and say, I have the solution, even before looking the problem. So
but this question was more also related to time management. I mean, what is your protocol? Do you say, I do a professional training each year, or I attend a congress every other year? Like, how have you organized that in your career?
It's a lot of work. So this time is really taken definitely on our personal work, or on our personal time, sometimes on our family time also, unfortunately. So it's difficult, but we try to manage family time, some also personal time, but we spend a lot of time in the offices and also in preparing.
So in your case, it was actually taking the extra step. Patient care at the center, and then the personal development and learning on top.
Sure, because we have to run our practices, so it's a normal practice as everybody. So
I know, I'm curious, but you hear now offices and companies who say, Friday is learning day, so we don't take any operational work and we do development. But so I was curious if that is happening in dentistry.
When it's private, it's difficult because you have financial.
Of course, that's why I was curious. How is that in yours?
I think that there is a mindset. I mean, there is a nice movie, Kung Fu Panda. I don't know if you know, but there is the teacher that says to the panda, if you do only what you know, you will be never better than today. And this is, I think, the way we should see our profession. Also because make the profession much nicer, new, but this is the point. I mean, more we enlarge our technical capability, better will be what we can do for our patient. And we should really not be locked on a single treatment, on a single approach. Otherwise, you're just taking the patient and put in that box that you know, or the other box that you know.
And in complement for what you're asking, I think it's important to have a team also. It's very difficult to do it ourselves alone.
Sure.
So it's important to have a good team, whether colleagues or assistant, and to trust them. And to really have a nice spirit between all the team in order to do what we do.
And you mean also on the specialist level? You work together with a team of specialists?
Yes, also.
Yeah.
And specialists and
the other stuff as well. Yeah, it makes sense. It's a team effort. Let's take it back a little bit back into the session. You also talked about complications post-op or post-treatment in a later phase, perhaps even peri-implantitis showing up. What have you taken away from that segment of the session?
So I think peri-implantitis is really a problem, a big problem that everybody is facing it. And today, unfortunately, there is not a standardized protocol to treat it. Okay, we also know how we can avoid not all peri-implantitis, but how to reduce the prevalence of peri-implantitis. And concerning the treatment, I think if you ask any implantologist during the EAO conference, probably everyone has his own protocol. And so this is a real difficult stuff. And Mario did it very well because, he talked about his experience, about his technique, but it makes sense because he is periodontist also, and his approach is really close to what's happening in periodontitis, so we get experience from the results of surgery around teeth. Even though it's not the same, we don't have the same biological environment, but anyway, we have this also vascularization, we have the bone here, and the management of the soft tissue that he has shown is really interesting. I think it's a good step forward. By management, by treating the peri-implantitis. Treating the surface, filling the gap with some hydroxyapatite, collagen, bovine bone. This is it's regular. It's nothing
it's
special.
Fixing the defect.
But I think grafting. He was grafting with thick connective tissue graft, and handling of the flaps, incisions, elevation, and suturing, as he's doing on the periodontal defects, means microsurgery. I think this could make a difference.
That's a specific novelty that he brought into this Congress.
Yes, he published also.
Of course, but that's what he showed.
Very well spread, so this was a good opportunity.
Makes me curious, yeah.
But again, there was a very strict selection on the case. I mean,
for this specific treatment of the peri-implantitis.
Yeah, but and he mentioned at the beginning extremely clearly. Maybe it means that when we are looking the literature, all the implants with peri-implantitis are placed in the studies, and doesn't matter which is the implant position, which is the matter of the type of prosthetics that has been applied on top. I mean, these are again crucial element, because then I'm going to treat those scenarios where I know that the performance is going to bring to the target. Mm-hmm. Because it's obvious that if you do peri-implantitis treatment and the patient 1.5 years later is back on the same problem, what are you going to do next? That you try again with that surgeries? So being able to recognize since the beginning if it's good to invest biological cost, economical cost, and time on try to solve the problem, or decided to say, look, this is the best way, is to take it out, place a new one in a proper position, and then perform anyway a little bit of bone augmentation, the connective tissue graft. But you are investing on something that has a starting point which is different.
Yeah.
And we go back to the
And then
selection.
we're full circle. So you're again at case selection, again for the choice of treatment, in this case of a complication. Exactly.
Yeah.
If we walk away and we go back in either the clinic or into our research offices, what do you hope that people who've been in the room with you or watch this session online, what will they actually do in the next time they start up?
Probably, I hope that maybe they will think, they will take more time to think about the case, to look at the case, to document the case, and to do the proper diagnosis. Mm-hmm. And as Luca was saying concerning, for example, peri-implantitis, before going to the surgery, be sure that this is a good case. Yeah. And that was also Mario was saying during his conference, if the implant is not placed in the good position, so we cannot go through the surgery. Yeah. So really looking at the case, selecting, doing the good diagnosis, selecting again the proper treatment is really a mandate.
Keep in mind that alternatives might be better options.
Yeah, this is before treating.
Yeah, of course, before treating, but even when dealing that,
but then we have to manage sometimes complications, especially after bone grafting, for example, dehiscences or exposures or infection, because we can, with bone augmentation, whether autogenous or GBR, we have infections, and could be not an easy time for the patient and also for us. So we have to deal with it. And there is a proper also protocol to do it. So they didn't have time to go into all the details because there is every complication has its protocol. But at least it makes things clearer to distinguish the complications and the treatments.
Exactly. So and your wish is people actually take the time for that. Take your time, document, analyze before you move forward. Right?
Yeah.
Luca, what do you hope people watching?
I think that there are 2 points more that I hope that they were able to fix. First of all, that we are all on the same room regarding complications. So there are no people without complications. Yeah. And we should also lose that fear to share the fact that we have failures, because by sharing, we can find better solution together. And the other point is that there is for sure an emotional component on managing the complication, which is not just the technical things of doing something in the mouth, but also how to check our stress. Because, stress is bringing us on the side of no rational decision.
Exactly.
So, and this is something that we have to control before to being able to take the right decision.
Yeah.
So I think that as Frank Renoir, for example, is bringing this topic more and more in the dental field, we should really also looking for training to control ourselves,
Yeah.
to manage our stress.
Yeah.
And again, to manage our stress, it's important before to have a clear idea what I'm going to do if this negative event is going to happen, what is going to do if is this another negative impact. So it means that we have again to prepare ourselves before acting.
Exactly.
So action is just something on doing, but the master plan is happening before. And that is the key for success, or reducing the risk on doing the wrong thing.
It's an interesting takeaway because you both are kind of in the same alley. Yeah? So take the time, document, take away the stress, realize that the stress is there. That's why you probably didn't take the time. Eh? You just rush in and that relationship is under pressure.
Just to add a point concerning what you were telling, it's this fear exists more with the beginners. We still have the stress, but we see it definitely more with beginners.
Yeah.
And I don't know why, but it looks like when we have a complication in implantology, it's like we never had complication in dentistry. We can have a complication in an endodontic treatment or any restoration, but when it happens with an implant, it seems like it's the end of the world. No, okay. I tell to my colleague when they ask me, when they call me for that, look, not all your endodontic treatments are successful. So you can have a failure in bone grafting or in an implant, and there is a solution, as you were saying. So, so I think this is also a message,
I guess,
an important message.
Then we're back on the topic of timing. I mean, an orthodontic treatment goes a lot slower than an implant dentistry surgery, right? So that's where the intensity might arise from. Cool.
Yeah, that also the patient expectation. I mean, we as a dentist sold the point or sold the message to the patient that implants are forever, that everything is going to run smoothly and everything is going to happen fast. So we create ourselves.
We create that speed. Yeah, of course. Yeah, makes sense.
The pressure.
Exactly. Well, thank you, Hadi. Thank you, Luca, for having this conversation around the topic of the timing of complication management. I can imagine you are now very curious to actually watch the full recording of that session. Well, it's available on Monaco Online. You'll see Puria Parvini, Roman Dolivieux, and Mario Ricuzzo talking on these topics. And if you know anybody who might be interested in anything you've just heard or said, make sure you share this video with them and you invite them to this platform. Thank you for watching.